Examination of the thyroid gland. The normal gland consists of two lateral lobes extended from thyroid cartilage to the seat tracheal ring and connected by the isthmus. It is related posteriorly to the carotid artery and recurrent laryngeal nerves. The four parathyroid glands lie just within its fascia posteriorly. For the examination, look for swelling or asymmetry from the front and the side. Ask the patient to take a sip of water into the mouth, then ask him or her to swallow. Swellings of the thyroid usually move freely on swallowing, and even a retrosternal goiter may be detected in the suprasternal notch. Palpation is best carried out from behind the seated patient with the fingers over the anterior triangle of the neck pointing downwards towards the suprasternal notch. In Graves' disease, that's exophthalmic goiter, the thyroid is diffusely and symmetrically enlarged with a softish consistency and a systolic bruise on auscultation. The gland of Hashimoto's disease is of similar appearance but is often firmer and may be slightly tender. In subacute or dequaveinous thyroiditis, the gland is very tender. Diffuse enlargement is seen with many non-toxic and iodine-deficient goiters. The nodular goiter is frequently symmetrical and firm with one or more nodules. Palpation may be deceptive in that what seems to be a single nodule often turns out on further investigation to be just part of a multinodular goiter. Single nodules may represent functional adenomas associated with thyroid overactivity. So these functioning single nodules should always be viewed with suspicion and investigated further to exclude malignancy. Undifferentiated carcinoma of the thyroid may be present as diffusely enlarged of the goiter, which is fixed and fails to move on swallowing. Palpate carefully for enlarged local lymph glands, which may be the site of secondary spread. Very large goiters may embrace the whole neck or cause superior venicaval obstruction. When the goiter is completely substernal, a clinical diagnosis is often very difficult.